So I talked a little bit about scope, talked quite a bit about scope yesterday, but just to sort of drill down on it a little bit more, an important part of your application, no matter what application you're preparing, you have to make sure that you have demonstrated in your application that you have a strong sense of how long everything takes. So that's sort of your time budget. You know how long it's going to take to identify subjects, recruit subjects, consent subjects, screen them, this is really a key element. If you start and you say, you know, I'm going to go out to the western part of the state and start looking for subjects the day I, get my first dollar, you've wasted a lot of time. If you have letters of agreement that are in your application that show that you already have access to this patient stream and that you have run patients like this, you know exactly how long it takes, you know what your subject mortality rate is, you know what kind of problems you're likely to encounter, and you can come up with an informed estimate of the time requirements, you're way, way, way ahead of the game. And if you can demonstrate that your project will hit the ground running, all the better, especially for a 2 or 3 year award. So these are the ancillary agreements. So these all need to be in place. People often, and it's amazing how reviewers will pounce on this, there's no page limit on letters of agreement. You can have all the letters of agreement you need, and those can be very powerful because the truth is, in most cases, you're the one who writes the letters of agreement, the letters of support. You write this letter, you describe your project, you describe how enthusiastic I am about your project, and you send this to the clinic director of some place where you want subjects, or to your department chair who's going to provide release time, and all of these different things, and you include all of those letters. Reviewers will identify when those letters aren't there. They'll barely read them when they are there. So, the presence of the letter is really what you're after primarily. You've got to make sure you have access to population numbers. You can include those numbers in the letters. So that can be a really effective way to demonstrate feasibility, to say, yeah, we see 300 patients a week that are like that, and I don't think it should be a problem getting 4. If you need access to specialized equipment like scanning equipment or things like that, eye trackers, things that may not be part of your lab, but you need a lot of access to it, be sure that you have letters of agreement in place giving you all the access that you're going to need for that project. If you're going to have, so this is a little trickier, so if you have mentoring guidance, most of the mentoring you might need for RO3s in particular and K awards for Fs, so yeah, everything except RO1s, you'll need letters of support unless they're key personnel. So it's better if they're among your key personnel, and then with the new biosketches, they can write quite a statement in that biosketch in terms of how they're going to support your project. So you can't do both, but make sure if these people are part of your consulting or support team, make sure that you have at least a letter from them, but preferably a biosketch. Again, you want to be ready for specialized equipment if you need to buy it. You want to be ready to go. You want your budget to reflect the fact that you know what model numbers you need. These are for big items that your project really depends on, like an eye tracker or big EEG setup or something that, all of that equipment is really, ready to order, right? You don't want to see people waiting while they're raking in NIH dollars. And then if you have a good estimate of how long it takes to do data analysis. You should take a moment where you're realistically looking for what your grant needs to provide. It's not enough just to say you need a grant because your department chair says you need a grant, or because your career path says you have to have a grant, and just getting the grant is the end in itself. You really should take a close look at what you need it to provide. The most important thing most faculty need for it to provide is summer salary, right? It's July and baby needs new shoes. So 3 months of salary support is probably where you start, and then release through the year. And now you've taken up, it's $100,000 a year. So this is going to include not just your salary, but your benefits as well. So you've already taken up a pretty good chunk of your RO3. So you may need co-investigators and consultants. Hopefully you need graduate research assistants. I really hope you need those. That's our survival. You probably need postdocs, maybe 1 or 2 postdocs, although that can be a little chancy for a new PI to budget in a postdoc. Reviewers can feel like you're not ready to guide a postdoc. So then you need your team and somebody that can provide guidance to postdocs and things like that, so that can work. Research assistants, a lab manager, programming, a statistics consultant. The more of these people you put in, and they might be with 2%. Sometimes statistics consultants can be 2% of their salary. So these don't have to be big, expensive people, but the fact that they appear on your application shows that you've planned out who this team is and how you're going to provide for their care and feeding. You may need to buy some equipment, but about 80% of your budget or more should be people. You should not look at a grant as a way to get your lab equipped. That goes over very poorly. That actually shows poor institutional support. When you went to your institution, you got startup funds that established your lab. You have collaborations with people who already have operating labs. So this is not the time to fund your lab. So there's some equipment. If you have a little bit of specialized equipment you need, if you need a portable audiometer to do something, or you're not going to buy a PET scanner, but maybe you're going to get a frequency analyzer, or some computers or something like that. For an R01, you might get something like motion analysis equipment, for example. Subject reimbursement, travel, other supplies. So just sketch out your budget, what it is you need your grant to provide.